Are you a physical therapist interested in sports physical therapy and you're wondering where to start, what path you should do, or am I on the right track? This video is going to be perfect for you. My name is Dr. Chris Garcia. I'm the CEO and founder of the Chris Garcia Academy. I'm a physical therapist, residency trained sports clinical specialist, and I've been working with professional athletes for 15 years, and I own a multi-location cash-based practice in San Diego, California. I'm here to help you develop that path as a physical therapist and help you navigate which path are you missing, which path should you go towards. So I've broken this down into three categories. Whenever you're a sports physical therapist, there's a couple different paths that you can take. You can do a residency, you can take your SES on your own, or you can do neither of those and figure it out all on your own. And everybody's preference is completely up to them. I did a residency, and immediately after residency, I did an SES. So I do understand these components, but I also mentor thousands of physical therapists who aren't interested or able to do a residency. They have no interest in doing an SES. And so if they're doing neither one of those options, what do you do as a sports physical therapist? And I'm here to answer those questions. So the benefit of doing a residency is you develop the clinical skill set within all domains within the SES and sports physical therapy, and that can be acute injury management, that can be sports rehab, it can return to sport criteria, it could be injury prevention, it could be strength and conditioning. There's so many things that you develop within a residency. Now, what's the benefit? So you develop the clinical skills. That's beautiful. You develop those very, very quickly, and whether that's a year or a year and a half or 2 years, it's all consolidated. Now, the benefit to a residency is that you get clinical reasoning because you have mentorship, somebody above you or beside you that just works with you on navigating when to use those skill sets, how to use them appropriately. So, and ultimately, experience is important. You get the skills, you get the clinical reasoning, and then you get the exposure. That's the toughest thing. How do I get into a high school football game? How do I get into a wrestling tournament? How do I get into marathons? Ultimately, you're getting exposure. So the residency helps you consolidate those three things. You're developing the clinical skills, you now develop the clinical reasoning, and you get exposure in a very, very short time period. So if you don't decide that residency is for you right now or later, or you don't even want to, that's okay. So then what if you say, okay, I want to get my SES. So the problem with just getting your SES is you're going to get clinical skills. Why? Because you're studying, you're figuring out, is this for you? Is this the right opportunity for you? Absolutely, it's not a problem. Here's what you miss with just doing the SES. You don't get the clinical reasoning and you don't get exposure. And that's the hardest thing for people to do. I mentor physical therapists who have taken both of these routes, and the people who do the SES, that's the challenge is, now what do I do with this skill set? How do I use this, and how do I get in front of people? And you might be laughing at that because that might be you right now. Now, if you don't do either one of these scenarios, okay, and that's great because I have physical therapists who ask me all those questions all the time. What do I do if I don't have those opportunities, or I have a family and I can't dedicate that time, or whatever it is? Everyone's life is a little different. So if you have neither, you are now responsible to develop your own skill set, right? So if you're doing that, the typical route is you do one CEU per year, or maybe two. If you really think about it, this is probably about 12 CEUs inside 1 year. So if you go at that rate, in 12 years, you're going to have the equivalent of being a sports PT. Now, the problem with just developing those skills is there's no clinical reasoning behind any of these CEU units. You don't have anybody besides you every single week, every single month telling you which direction to go. So the ultimate component is, what do you need to develop to make sure that you become the sports PT that you want? Ultimately, you're going to have to find exposure. You're going to have to get that ability to be out in front of people or out at a tournament. The question is, once you do get exposure, do you have the clinical skills to support that as a sports PT? And once you're there, do you have the clinical reasoning to navigate whether this is going to be a good decision or not? And that's where people have the challenge. I bring this up not so that you can go one direction or the other, where you can find the next steps for you. So if residency is not for you, and the SES is not of interest, so then the question becomes, how do you become a sports PT and getting the clinical skills, the clinical reasoning, and the exposure? That's the question you have to ask yourself. And I can tell you this, it's not going at the current rate you're at. I wouldn't do just CEU units. What you need to do is you need to find an environment or a mentor that gives you the opportunity to develop the clinical reasoning. How do you put these skills together? One person or a few people or a group to give you the clinical skills, help develop the clinical reasoning, and help you get that exposure. And the ultimate goal for you is you want to be a clinician who feels confident, who doesn't have that fear that you're going to be too aggressive or too conservative in any instance. So how do you put yourself in that best environment? You find individuals in your local community or virtually to help put you in that experience and exposure. Now, if you work towards just developing clinical skills, you will be stuck in this cycle where now you have all these skills, but you don't know how to use them. That is a common complaint that I have for physical therapists that I mentor. I've taken 27 CEU courses and I don't know what to do with them. I still don't have athletes in front of me. And that's because you haven't learned how to get exposure, get yourself out there. And next, once you have all of those skills, how do you put them together? And that's a component that you have to be able to figure out. What do you want out of your career? If you really want to be a sports PT and have all those domains captured, whether that's acute injury management or sports rehab or strength and conditioning or acute injury management or sports rehab or whatever it is that you want, if you want to have the clinical skills inside a clinic and grow at the rate you're at, that's fantastic for you. But if you want to be a sports PT who has the skill set, can be able to manage anything clinically, on the field, in the clinic, in the weight room, and in the off season, whether that's injury prevention, now you're considering yourself, you can handle all domains at any given time. That requires clinical reasoning and the exposure to get yourself to that point. So wherever you are, my opportunity today was just to give you exposure into the things that you need or that you're already doing, and maybe you're on the right path, good for you. And if you're not in that right path, how do you get that? And for the individuals who are wondering, well, how do I get all of those things? How do I get the exposure? How do I get that clinical reasoning? And that's why I created 2 programs for any PT or sports PT. I've been practicing for many years, and my goal, my mission, my passion is helping people like you navigate these. Maybe you've already done a residency, you still feel stuck, you have all these clinical skills you haven't been able to get together, or you did your SCS and you still don't know how to put together. I created 2 programs. One is my Kickstarter. The Kickstarter is for individuals who want to get their feet wet inside sports PT. They want to have an opportunity to just see if they need, what are their strengths and weaknesses, what do they want to have exposure to, whether that's concussion management, on the field management, spine boarding, if not strength and conditioning, to develop the strengths and weaknesses that you already have and figure out what is that next step that you're needed. If you have exposure and you have the clinical reason, you've done the residency, you've done the SCS, and you're doing well in the clinic, but you feel you're not getting the outcomes or the athletes that you want on your schedule despite putting in all the work, that's why I built my academy. My Sports PT Academy is for individuals who are further along, who've maybe already taken them at Kickstarter, or those who have already made those mistakes. They're at least 3 to 5 years into their clinical practice and they feel stuck. They want to be able to navigate certain cases. They're not sure if I should push this rehab process a little bit shorter. What do I do with this case? How do I get a little bit more athletes? I want to work with baseball players. I don't have those on my case. I want more soccer players. And that is an individual that's perfect for that. So wherever you are on the sports PT spectrum or sports PT field, this gives you an insight into what it is that you're missing. And for some of you, you feel lost. You're like, I've done all the CEUs, I don't even know what to do next. I've gone to maybe some conferences, CSM, or some type of private practice or anything else to get you on the right path, and you feel lost. Hopefully this video gives you a little framework so that way you can continue to thrive in your practice. I know that you love what you do and you want to continue to learn because you're hungry and you're smart, and you want to be able to put all these resources into place. So I hope that helps. If you have any questions about any of the courses or any of my content or questions about this video, go ahead and use any of the links below to reply, and I'm happy to help. Good luck on your continued professional journey.